Let's get down to it. The single most important thing that people want to know about is how much does caregiving cost here in Michigan? Well, Medicare does cover home care, and so do other insurance companies. So, me being a physician, I actually order a lot of what's called skilled home care. So, skilled home care is defined as intermittent nursing visits. So, this means quick and short term nursing visits. So, usually for 15, 20 minutes at a time, a nurse will come to your house once, twice, or three times. So Medicare will cover a nurse to come to your house. So if a doctor writes a prescription for you, then a nurse will come to your house and help you. But this has to be skilled care. So this means stuff like wound care, helping you change an IV bag, a colostomy bag, a catheter, something that you can't do yourself and something that a doctor has written a prescription for you about. In order for insurance to pay for home health care and dementia care, you need a few criteria. You need to be homebound and you need to be seeing a doctor who can write you a prescription and certify your care. And you must be homebound. Now, homebound means a couple different things, but generally you should have a very difficult or complex time getting to your doctor's office. So what that means is mobility issues, making it very difficult to transport because, hey, we can all call an ambulance and if 6 people are helping us, everybody could probably get there, but it's not practical. So Medicare covers intermittent skilled nursing. This means maybe 1, 2, or 3 visits and short visits per week. It covers physical therapists, occupational therapists, speech language pathology, social services, an aide to come and help once or twice a week, and maybe durable medical equipment. This does not mean somebody's coming for 4 hours to sit with you or for 8 hours. That is something called senior care or private duty care. This is generally private pay. So this would be a service like Assisting Hands Home Care, which I linked down below. But these are great services where you necessarily don't need to follow all these pre-qualifications because the goal of skilled nursing is for very short chunks of time. It's not for 24-hour care. It's not for 8-hour care. It's not even for 4-hour care while you need to take a break to go to the store or go run some errands while your loved one needs care. This would be more of a private duty care. So that's where the two health care and home care services differ, although the names are pretty much the same. Consider that private duty home care that covers that type of care and services. What Medicare does not cover, it does not cover things like somebody sitting with you for 4 hours, 6 hours, 8 hours. That's where a company for private home care, like Assisting Hands Home Care, comes in. So Assisting Hands Home Care can provide those rates. So the thing is that free? It's not free. Around the country at an agency, the private home rate is about $25 to $40. So that's going to be the rough average because a caregiver has to get paid for that. And there's a team, like right now, we have a whole team training, scheduling, vetting, drug testing, caregivers, because what happens is this is a brutal job. It's not easy. It's hard to take care of people. And basically, what we need to do is find the best people. So we are interviewing and training people all day long because it's not something everybody can do, and it's not something everybody's cut out for to do long term because it's sad. It's hard on the body. There's a lot of lifting, changing, a lot of sensitive moments. So you have to find the right person to sit with, either yourself or your loved ones. So we like to consider us to be on the lower end, but the highest quality. So you can check that with our reviews, in my unbiased opinion, of course. But that's why we bring you these videos, because we want to bring the best possible cost, and we believe we're extremely competitive in that $25 to $40 range. We are on the lower end. You can price shop around, but we are on the lower end comparatively. And we do provide the services that Medicare does not. So what else does insurance cover? So it does cover that intermittent or temporary skilled nursing care for those special needs, but it also covers physical therapy, occupational therapy. It covers medical equipment as well. But again, you need a physician to write for those things. It also covers a social worker to come out to your house. So social worker can come out to your house. Sometimes this is good to potentially see if you're eligible for Medicaid or you need some extra help like memory care and assisted living. But again, a prescription has to be written by your doctor and it has to be done every 60 days. So here's where private duty home care like Assisting Hands comes in. This comes in because people need more than that. This is considered custodial care. So long-term care is not designed to be covered by health insurance. It is meant to be very short, rapid coverage periods. And what happens is nursing homes can be expensive. Assisted living nursing homes are very expensive. These things are generally not covered, and if you don't have money, there are some benefits. And actually, as we talk about that, if you're really tight on finances and you're just completely out of luck, click below. We have an ebook about everything you can do in Michigan. So these are all the programs, all the assistance packages, Medicaid, Medicare, and what it covers. Down below in the show notes or in the link, we came up with a guide. Go to our website, michiganpersonalcare.com, and you can get that guide. But basically, Medicare covers skilled nursing care, PT, OT, social work, medical equipment like beds, wheelchairs, that kind of thing. Everything else you have to cash pay. So what do you have to cash pay for? So that's the private duty in that $25 to $40 range. Insurance companies generally don't cover what's called custodial care. They cover short-term intermittent care for short durations. So it does not cover 24-hour care. It does not cover homemaker services, house cleaning, bathing, dressing, or using the bathroom. It does not cover medication reminders or rides to your doctors. This would be taken care of what's considered private duty home care. So a company like Assisting Hands, which full bias alert, I am a big fan of and part of, but Assisting Hands can help with all of this. It can help you get to the doctor's appointments. It can get you help with those 24-hour daily living tasks. So if you're in Michigan, give us a call or check out the website. Check out the ebooks we have on the rates, which are very competitive, and the different ways to pay for it. Well, this is getting rides to your doctors, general housekeeping, having someone sit with your parents. If they can't get up, helping them get to their walker, helping them get to the bathroom, diaper changes, grooming, keeping their hair, helping them get dressed, helping them go for walks, helping them get to the grocery store, cooking food, cleaning the house. We actually have a list of about 150 things that our caregivers do and are trained to do. Now, what can you do if you can't, if you're kind of beyond a one-on-one caregiver or you can't afford it? That's where nursing homes come in, and they're kind of starting at the $4,500, $5,000 range. Now, an option that we work a lot with is people in independent living facilities, and this is why agencies like ours are actually kept so busy, is people actually find it cheaper to get 4 hours or 8 hours or 12 hours of care a few times a week or all week long, rather than paying for one of these expensive facilities that can cost $10,000 or so a month. So the floor is roughly $4,500. With inflation going up like crazy now, it's only going to go up. We have been able to keep our prices relatively low with inflation, but do the math. Is $25 to $40 an hour cheap? It's not cheap. Nobody's saying it's cheap. It's very unpleasant. But the reality is, if you have to put yourself or your loved ones into these facilities, you're talking of a base price of $4,500, $5,000. There's a lot of beautiful facilities like this with care staff, but they're not cheap. I've seen $5,000+ as the floor, and we're talking $10,000, $12,000 for the high-end ones. Now, it's not going to be forever, but if you have a lower level of care need, 4-hour shifts, 8-hour shifts, 12-hour shifts a few times a week or more frequently can really, really be the more cost-effective option when you do the math long-term. You can pool people together and share a caregiver. And that's another thing that we do, is if you have a husband and a wife, one caregiver can work with both of them. Or potentially we work for some facilities here in Michigan, and you can give us a call, but sometimes you can get 4, 5, 6 people that can share the costs on a caregiver, depending on the facility, or even some of the facilities that we take care of people at. We can take care of 100 different people in a large facility with a team of caregivers, and that could dramatically lower the cost. So what this means is, rather than somebody being one-on-one with you the whole time, we have a team that goes and helps 5 different people get dressed, helps 5 different people get groomed, helps 5 different people go for walks during the day. So that kind of stuff is possible. But we've come up with guides, how to help you pay for it. Check that out, michiganpersonalcare.com, or click on our ebooks below and it'll show you how to get those books. It'll show you all the options for getting your loved one taken care of if insurance is not covering these things. Because the reality is Medicare and private insurances are not designed to take care of these things, and it can be expensive. We also have guides on long-term care insurance and other options, but that's in the book. Check it out. And if this helped, give us a thumbs up, give us a like, give us a subscribe. Thank you. Private duty home care is not the cheapest. It's like $25 to $40 per hour on average across Michigan. That's why we came up with a book. How can you pay for these things? At Assisting Hands Home Care, we try to provide competitive prices and open up all options because it's not cheap. Nursing homes are even more expensive. So if you don't need one quite yet, consider private duty home care as an option. And if you need anything, just call our office. But check out some of these videos, subscribe, let us know if we're doing a horrible job or a great job. We could definitely use the feedback to keep making you great videos. Thank you.